Okay, if you've just clicked on this video, you are clicking onto the second or part two or an update of a previous video that is on this YouTube channel. I suggest you go back and watch that. If you have already seen that and you're currently in the process of researching hydrocele, self-aspirations of a hydrocele, or you're just doing a little bit of research in general on the matter, this is essentially an update from my previous video as to how life is going. Again, this is not medical advice. I'm not a medical professional. I have no background in medicine. I'm purely giving anyone who's looking into the matter an insight into my own personal experiences with hydrocele and hydrocele self-aspiration. My last video was made on the 1st of January 2025. It's currently the 23rd of July. So I've been doing this process myself for the last nearly 7 months. I've got a lot of updates, and I guess I wanted to recite and give a rendition of some of the learnings throughout the last 7 months, some of the do's and don'ts, some things that may make it easy or difficult or challenging, and yeah, I guess just let people know who may be looking into where I currently am with my experience. Since the biggest update is since that first video, I had a meeting with a urologist, a specialist, at the end of February, and we discussed essentially surgical options and some of the risks that are involved with hydrocele surgery. If for context, not keen on surgery. I wasn't very keen to begin with, and I guess I wanted an opportunity to talk with urologists and really understand, where does that sit. I currently live in Australia. In Australia, the preferred practice and methodology of dealing with a hydrocele is surgical repair. It's not just as simple as me trying to get to a clinic to do the aspiration process, because doctors tend to not refer that as a practice. The standard method in Australia. It can be different for older gentlemen where surgery may pose greater risk. They will perform aspirations, but in my age category, with my level of risk being low, surgery is almost always the preferred method. So it left me very minimal options. Talked to the urologist. I informed him that I was doing the aspirations myself, and I was expecting him to be shocked. When I talk with family and friends around what I'm doing, most people meet it with that kind of face, like you're sticking a needle into your own scrotum. And I expected my urologist to meet me with the same kind of reaction. But he essentially was sitting with his notebook, and I told him what I was doing, and he continued to nod, and I was like, oh fuck, okay. He continued to nod and just talk to me and ask me how it's been going, what pain level, what discomfort, and he didn't really touch on the matter at all. At the end of the discussion with him, he essentially gave it to me as I'm adding a little bit of fluff for the sake of the video, but he essentially said, I found a way to manage this condition. Ultimately, there are no nasties, as in I don't have cancer, there's no underlying serious impact to health if this doesn't get repaired surgically. And I found a way to manage the condition. He wouldn't advise it, he wouldn't advise others to do it, but do I want to weigh up the risks at my age of losing a testicle is one risk, erectile dysfunction with nerves around that area can be another risk, infection and general risk of surgery anyway, and a very lengthy return to normal process post-surgery. 6 to 10 weeks is the kind of timeline. Coupling that with the fact that he gave me a story of a client he currently has who's 40. He's on his third surgery. He's went through that process 2 times now, and it's still coming back. And he kind of talked to me about, unfortunately, hydrocele is a very shitty condition where I mean, if you're on this video, I guarantee you've looked at how they fix it, but they cut open the scrotum, they cut open the hydrocele, they restitch it the other way around, and that essentially removes the cavity in the pocket that's filling with fluid. The issue with that is the fluid is still being sent. The body is still sending it. The canal that is open, that is allowing that fluid to get into that area, has not closed. And, you know, quality of the surgery, quality of the stitch, scar tissue, there are lots of things that can just allow that fluid to continue to build up. It'll find a way. It's like water. It'll find a way through it eventually. The percentage of repair is quite high. If I remember correctly, when I was looking at it, it was somewhere around 90%. But I think I did see a statistic where 50% of all surgical repairs will re-encounter a hydrocele at some point in their life. So I don't know. That's kind of where I was sitting. I was a little bit like, you know what, I found a way to manage it. He kind of confirmed that in my head, in my own way. I guess I heard what I wanted to hear. I understand that. But he wasn't concerned, he wasn't fussed, he wasn't worried, and he said, let's pick this back up if you want to. That was obviously the end of February. As I said, we're now into the end of July. The first aspiration I removed around about 120 to 130 milliliters of fluid. It was the largest one I've done to date. And I was hoping at that time that I would get around 4 to 6 weeks of time in between having to do that. That is probably a stretch. I don't quite get anywhere near that mark. I could stretch out to 4 weeks if I wanted to. I've probably done around 12 to 15 aspirations myself at this point. But I'm doing it anywhere between 2.5 and 3.5 weeks. Sorry, I might jump around a lot. There's a lot of information to cover. A couple of things I've found is it's probably filling up at around 5 milliliters to 6 milliliters per day. So 10 days, 50 mils, 20 days, 100 mils, for example. And 20 days is just below that 3-week mark. And that's around roughly with what I'm getting when I'm aspirating. Some of the learnings that I've had, I wish I had my equipment with me. I'm traveling for work currently, and I'll show you what I'm using, but I'm still using a 22 gauge cannula. And I'm using a 50 ml syringe to draw. A couple of learnings I've done is the earlier and the faster I do it. So if I'm looking at 2 to 2.5 weeks, and let's hypothetically say, I've got a big weekend coming up. I'm going away with my girlfriend, my partner, and maybe we're going away on holiday, or we're going away for a weekend away, and I want to perform sexually. I don't want to be uncomfortable. I don't want my testicles to be uncomfortable. I don't want the visual optics of a large area to be down there. I've aspirated at that 2 to 2.5 week mark, where there's maybe 80 mils of fluid to draw. It's much harder to draw when the skin isn't taut. The first time I done it, in my last video, I talked about essentially pushing this, like touching the syringe on the skin, and eventually, the needle on the skin, and eventually the skin just gave way and the needle slid through. If I'm aspirating earlier or sooner, it's a lot more challenging to get that needle through the hydrocele. It goes through the skin of the scrotum quite well, but the ability for me to drive it through the hydrocele it can be challenging. There's a lot of give. It doesn't want to go in. It kind of hurts. It's not the same as when it's 3.5, 4 weeks, where it just essentially pops it like a balloon. I've messed it up twice in the last 7 months. One, I thought I was in fluid, but I wasn't. And I pulled back way too hard on the syringe, and I created an air pocket in the base of the syringe. And I freaked out. I kind of just sat there for a little bit, and I was like, holy shit, do not let go of the plunger. I tried to essentially grab the plunger and the syringe together and pull it out, and obviously the vacuum seal with the cannula in the skin, it was a whole ordeal. I managed to avoid any complications, but I guess what I'd say to that is, first, when you're in the fluid, and as soon as you pull that needle out of the cannula, it will drain and it will start to flow. If that doesn't happen, you're not in the fluid. Do not hook up a syringe. Pretty simple. In addition to that, I also had a large blood blister underneath the skin. I'm not too sure if it was underneath the scrotum or if it was in the hydrocele itself, but one day I was trying to do it. I was doing it way too early. It wasn't going through. I was getting frustrated, and I definitely hit a vein. It didn't cause any further complications. It's just that it blackened and I could see the blood underneath the skin. The only other thing that did happen, I guess, is that the colour of the fluid I was drawing changed quite dramatically. And it kind of gave me a little bit of a worry, but again, no further complications. In regards to the site and location of the injection, I've got pretty good at finding like an angle and an area, so I'm still using the light on the back of my torch. Shine the light underneath the scrotum, it lights up the area, illuminates the area. You can see all the veins. I know within the first millisecond of that syringe just being even slightly on my skin, if it's going to be a painful location that's going to bleed, or if it's going to just slide through with no blood at all. There are some parts where it'll look like I'm not near a vein, and I'll be like, this looks like a good location. I'll touch the skin, and it's like, oh, nope, not there. I'll touch the skin, and I'll be like, okay, and it'll pierce the scrotum, like completely pain-free. And I'm not joking when I say that, completely pain-free. There are some areas where I'll touch that syringe, that needle on my skin, and I do not feel it. It does not bleed. So there are some locations where I'll know within, again, a millisecond of it touching, like, oh, nope, not quite there. Oh, not, there we go. And you get so well attuned and well accustomed to where them areas are. I've had no issues with the draw. Once I'm in, I'm usually pretty good. I guess a couple of things that I would say is take your time, like slowly, really slowly. Don't pull back on that plunger hard. It's in, I've pulled the needle out, it'll start to drain. Just take your time, like relax. It's like, oh my god, I've got a fucking needle in my area. Like, oh, attach the syringe and just really slowly back on the syringe. Pull, and eventually it'll start to go. It does not get painful during that process, right until the end. And what I think is maybe happening is the plastic sheath is still in the area, the hydrocele has obviously shrunk, most of the fluid would be out, and it's maybe touching things in there, that plastic bit's maybe touching things that are like, ooh, that kind of gets a little bit sore and a little bit painful and a little bit like someone's flicked your testicle. I know that sounds wild, but if you're a guy, you'll know what that feels like. If like someone's just pung you, and it's like, fuck. It's not quite like being punched, but it's like there's something not happy with that area. What I've found, if I'm really trying to get all of it, and I'm trying to get as much of it as I can, is after the first 50 mils, I will reposition the cannula where it's facing. So if it's in, I don't know how to, if it's like this, I'll reposition the cannula so it's facing back up towards the top of it. So it's definitely not poking down or pointing anywhere down near any areas that could be painful. And I tend to find that works quite well. Once it slows down on its own and it stops, and the pressure that you were pulling back on very slowly, once that stops, don't go any further. Just if it, don't fish around, don't try and get more and be like, oh, I don't want to have to fucking do it 3 days sooner. Just take that as your lot. Like, you've done it, you've reduced the swelling, that's what you wanted to do. Take the sheath out, relax, and done. I wouldn't go fishing around. It's not worth it. I've done it twice at the start, and it'll hit something and I'll be like, no, don't like it. I wouldn't advise it. What else? I guess where I'm at mentally with the idea of surgery is I am considering it more and more. It's not annoying for me to have to do. It's not frustrating. It's not pain in the neck. It doesn't hurt that much, and I'm viewing it as like I just want to keep on managing this as it is just now. But what concerns me is the long-term impact of me doing this with a needle through that area. Does the hydrocele start to thicken and develop scar tissue? Does Like, for example, I think of a diabetic stomach, if they're injecting insulin on a daily basis. I know that one injection every 3 weeks is on a daily basis, but there's a concern about what does that do to the hydrocele wall? What does it do to my scrotum? Does my scrotum get tight and taut? And so I'm a little bit nervous about things like that. Like, there's no information online. Like, good luck finding anyone else talking about this. And if you do, not in depth, and they haven't been doing it for years, I would assume there might be some people out there who are, but that information is not readily available. So that kind of concerns me. As a practice, the other thing that concerns me is if I'm doing a long holiday or trip away or working away, or kind of scheduling my life around, am I going to be somewhere near to a syringe or a needle that I can perform this process? Do I want to go to Europe for 4 weeks? Do I want to go to Southeast Asia? And how long am I going for? Timing, things like that. And again, I could go for a holiday for 3 weeks and not have a problem, but there's a couple of things there that might become annoying later on in life. Other things I guess I would say that I found is the affected testy and the affected side doesn't cause me any pain whatsoever. The only pain I get is from the other side, and it's usually because I've waited a couple more days before I've aspirated, and the skin gets taut, really taut around the hydrocele, and the space for my right testy gets shrunk, and he kind of gets bashed around the inside of my leg or against my work trousers, or he becomes uncomfortable. That's the only other, I guess, update for pain. Trying to think if anyone else has been in the comments in the previous one, or if there's anything else to touch on. I think that's really it. It's going well. I've continued to do it for the last 7.5 months, or 7 months, sorry. I've had no further problems. The urologist didn't seem to be too fussed. I'm being safe. I use gloves. I use an alcohol swab beforehand. I wash right after. I take usually about 20 minutes to lie down on my bed and just kind of relax. Don't let anything touch the area. It's fine. Life's good. There's no further updates. I guess I just wanted to give you some insights onto a couple of things that I've learned along the way, and that would be some of them there. So if you are still looking at doing it, good luck. Again, there's just no way. I can't imagine if you're sitting at home right now and you've still got a hydrocele and you've landed on this video. Honestly, I can't sympathize with you enough. Like, I'm back to normal, other than the fact that it comes back, and then I do it again and I'm back to normal. I get around about 7 to 10 days where there's no, like, I can't really see or feel a physical change, and then from 10 days onwards I start to go, it's coming back, I see, and it'll start to continue to fill. But for about 10 days I'm sweet. I'm normal size, no pain, mild injection. Take your time, use some of my learnings, and see how you go.